everyone. I'm Dr. David Gold, Vice President of IOSH, and I'd like to welcome you today to today's IOSH webinar on looking after the mental and physical health and well-being of remote workers during the COVID-19 pandemic. This is the second in a series of weekly webinars that IOSH will be hosting related to managing safety, health, and well-being during the coronavirus outbreak. And this week's focus is on a challenge now faced by many companies, their management teams, and safety and health professionals around the world. It's clear that in the global effort to protect people from the COVID-19 virus, the safety and health profession must help organizations protect the health and well-being of people who have now moved to work remotely from their own homes. This presents difficulties of its own. If before the COVID-19 outbreak, the issue of workers' well-being and mental health was a priority for workers, the pandemic has now magnified this issue. So this session focuses on how safety and health professionals are advising their organizations on safeguarding the mental and physical health and well-being of a distributed workforce. And we're delighted today to hear from Royal Sun Alliance Head of Health, Safety and Wellbeing, and IOSH Vice Chair of Trustees, Tony Bough, and IOSH's Head of Safety and Health, Ruth Wilkinson. We'll also be hearing shortly, toward the end of the session, with a special request from Dr. Ivan Ivanov, a friend and a former colleague who has a special request from us. Before I begin, I want to emphasize that this and the following webinars are a platform to inform and engage with safety and health professionals and others with a responsibility for safety and health at work. Please remember that this is a two-way channel, giving you the opportunity to share support and guidance on this evolving issue, whether you are in the world or whichever industry sector you're in. So at this point, I'd like to begin. I'd like to introduce Tony Bough. Tony is a Chartered Fellow of IOSH, Vice Chair of the IOSH Board of Trustees, and Royal Sun Alliance Head of Health, Safety, and Wellbeing. RSA Group is an international insurance provider with 13,500 people serving 9 million customers in over 100 countries. They are now dealing with the coronavirus. Tony, could I ask you if you could please share your screen, and we look forward to hearing what you have to say.
Hi, thank you for the introduction. It's very interesting times in which we live. Usually I'd be worried about whether or not I had something on my shirt. At the minute, I'm wondering whether or not my children will run in at any point. Therefore, I have a very nice background. I promise that I'm not self-isolating here. I wish I was, because the background looks absolutely gorgeous. So today, I'm going to be talking about what we've been doing at RSA whilst we're dealing with this rather unprecedented time. So just to set the scene for yourselves from a risk perspective rather than from kind of a company perspective. So yes, as an organisation, RSA, we were actually founded after the Great Fire of London, which I find quite interesting as we go through this kind of crisis, that actually my organisation was founded out of a different kind of crisis. We have call centres literally all over the world. We have organisations as part of our group all over the world, of which some were dealing with this before the UK, some have kind of have dealt with this slightly after. And as part of that, we're visiting customers. We've got people out there who are consultants, who are loss adjusters, going out into different companies, going out into different people's homes. And once again, this is from a risk profile perspective that I'm trying to set this scene. And we did have existing home workers, so maybe we had kind of a good take on this, maybe not, to be honest, because, you know, all organisations face a challenge, and certainly IT and being able to respond is always one of those. So very much let's think about about mental health and all the challenges that my organisation has faced as once again as a case study. So this crisis has very much had a distinct impact on people mentally, and let's not forget, so we have people, because we are key workers dealing with things like claims of all different varieties. We have people in offices, equally as well we have people at home, and how do we make sure that we kind of keep a team dynamic with that? People aren't used to working at home. Working at home, they've got to claim their own space. People work in the office, maybe they feel quite marginalised. We've got to organise that space at home. How do they claim that space back of an evening if it isn't that they've not got a dedicated space that they can kind of claim for work? And organisationally, this is massive. It's change. People don't like change. People get worried about change. How do we keep our people happy? How do we keep them aligned to our business focus? How do we keep them productive? How do we keep them from developing mental health issues? And very much that has been our focus. And to start with that, I'll very much throw out a quote that I do really like, because I kind of really buy into that if you look after your own guys, if you look after your employees, they will look after your business. So if you're focused on being a good employer, then you'll get great employees. I think all over the world we've seen examples of that over the past few weeks. Equally, and this is pre-COVID, if I'm honest, that this is the mental health and wellbeing engagement curve, where if you think about where your organisation is, very much you can't try and be what you're not. So if you're sitting in the basic, or if you're sitting in the intermediate, you don't want to try and be advanced. So if you think about where your organisation is in terms of well-being, you need to relate to your employees, however it is that you cope with the kind of situation that we're going through. I don't intend to go through all these. Obviously, you'll get the slides, but very much make sure that you are relatable to your workforce, because you need to be genuine. And certainly before all of this happened, we had 5 million workers who were suffering with mental health conditions. 92% of people with mental health conditions weren't feeling like they could talk to their employers. 40% of all workers globally were in high stress jobs. 651 billion was the cost to the global economy, with 12 billion working days lost each year. And this was before we were in the challenges that we were actually in at the moment. And the same in terms of the chief executive's response to this. So mental health was the top priority for 3 in 5 chief executives. 1 in 6 employers had a defined mental health strategy, but then this year they were looking to introduce it. Obviously, this year's very different to all the years that we've faced before, certainly in my time. So that is going to have a massive impact on any mental health strategy, whether or not you were planning or have it in the pipeline to deliver. We're going to have to make sure that we consider all of the things that we're going through at the moment. And in terms of the employee gap, once again, this is the employer-employee gap. Employees expect one thing, employers expect another at times. And very much I'm going to jump to the end here and say 63% of employees valued an employee assistance program, but only 30% of employers actually offered it. And even certainly in my experience, and I'd like to think my organisation's good at this. I'm probably patting myself on the back here because it's something I've very much pushed. But we promote our EAP, our employee assistance program. Some organisations have it as almost a get out of jail free card that they kind of guiltily keep in the back. Actually, we celebrate it and say, this is an employee benefit. Take advantage of all the different things that it offers. But only 30% of employers actually offer that. How many more are going to need and actually want this as we come through this unprecedented times? And change for us, it came fast. I think for lots of organisations it did. And I actually, and I don't sit within our BCM business continuity management team, but you know what? They were absolutely great at responding to this on a global basis. And what was even better is straight away we looked at our people and we said, how can we help our people? And it kind of humbled me in ways. I went from saying that I really like working for my organisation to saying that I was really proud to work for my organisation because of our response and the way that we focused on making sure that our employees were safe. And from a health and safety perspective, because that's what you're interested in, mental health was at the forefront, as was ergonomics, but both in and also outside of the office, which I am going to cover. Also, we can't ignore that leaders or line managers, whatever you want to call them, all of a sudden they may have great skills at being able to deal with people on a face-to-face basis, but actually all of a sudden they were going to need to learn to communicate in a massively different way virtually. So in the office, I had lots of questions, first aiders, how are we going to do it? What kind of advice are you going to give? I'm worried. And obviously we made sure that we gave that advice and we supported them. Social distancing, how are we going to do that? I'm worried. We introduced what we called zoning so that people weren't moving in between floors unnecessarily. We massively made sure that we can, and I personally don't like the term social distancing. I've actually introduced into my workforce physical distancing, because we shouldn't socially distance ever. We are social animals. We need to interact socially. However, at the minute we need to physically distance, and that needs to be a positive message, not a negative one. Or fire wardens, emergency marshals, whatever you call them, they're saying, well, what are we going to do? We've got less people. How are we going to do this? So obviously we needed to support them and give them the right messages and advice and support. And also all of this, we need a sense of community. All of a sudden we're virtual, we're physical, we're everything, we're everywhere. We need to make sure that we can interact and help and just be a team. And all of that was a challenge that we needed to massively get in front of, address, and really just help everybody. So all of a sudden, we had all of these different things that, and I'm going to cover these on kind of individual slides. So we need to make sure that we give information, that we sell the benefits of this, because so many times we talk about things like isolation, where actually we should be talking about the fact that actually we're staying at home to help others. So it's reframing the negative into the positive, so that we can all take hopefully positive messages and as a community kind of make sure that we deal with this and move with this. So we looked at what kind of information are we giving, what kind of benefits can we sell, what kind of, and by social media I mean how can we be social virtually, how can we look at people's mental health, claim some space, and also make sure that we have good relationships inside and outside of work. So in terms of information, I was really kind of blown away by the fact that this wasn't just me. I kind of can't once again kind of pat myself on the back at all. This is a team, HR team especially, where we're going, right, how can we be a one-stop shop where we're going to make sure that people can just get in front of this information, so that they can, rather than searching through our intranet, which is a library of information, how can we serve it up to them? And to my right there, you can see maintaining our health and well-being during COVID. What we attempted to do is say healthy mind, healthy body, healthy connection, healthy workspaces, and not saying that our leaders weren't healthy, but how can our leaders make sure that they lead? Let's serve them up some information in a one-stop shop, and then it goes through to some existing information that's always been there, and also some stuff that we've actually very quickly created for our guys. To the bottom left, I was really great. Our learning and development team got together with me, and we actually developed a module that was it's kind of an online magazine that you can flick through in terms of how to maintain your well-being. So ideally, certainly for us, we said, let's one-stop shop this. point them elsewhere. But if we can have like a front page where they can find everything, that's only going to make people happier, because they can access all the information that we've got as an organization. And then in terms of the benefits, yes, it's hard to sell the benefits when people feel like they're socially isolated. And once again, we're very much in my organization, and this is something I pushed at, talking about physically distancing. I never want to socially isolate. I want to socially talk to everybody, but I do need to physically distance between my colleagues in this country and every other country, because I personally go everywhere within our organization. So let's say to them, right, great, you don't have to commute, albeit maybe mentally in terms of commuting to work, you want to set yourself some kind of routine that you do, because that's great mentally. You don't have to commute to work, so maybe look at that as a benefit. Maybe, and once again, we've tried to say if the two of you are partners, maybe try and not work in the same room. Maybe one of you has to look after the kids one day or the other, or whatever, you know, everything differs depending on work circumstances. But maybe work in different rooms and then come together for time, spend more time together, as well as maybe spending time apart. Maybe you can learn new things, take the time to learn as partners, as families, pretty much whatever your circumstance is. And also from a social media perspective, how can we better use the technology that we've got? In-house, we have some absolutely great technology, and we've had to learn to say, in work, sending work data, you use work machines, that's it. You don't use anything that's not on work to send work data, because we keep our customer data confidential and secure. So within work, we've got internal email, we've got something called Yammer, which is it's kind of like Facebook for business, or if you're not familiar with that either, it's like Facebook, but it's for a business. So yes, let's use that in work, but actually outside of work, let's comfort ourselves that we have social media policies, and we're going to say treat each other with respect and stay within them. But actually, if you're having a conversation that's, let's call it acceptable banter, you know, have conversations, kind of however you want to term it, really. Different teams will want different media, and they'll find different media to use. So let's not feel like we have to control that, as long as it's not sending anything that's work related and it's just people conversing on a social basis. Let's encourage them. Let's even tell them what's out there. So we've promoted kind of all the apps that you can see there with social written in brackets. Let's empower people to have connections, because whilst you're physically distancing, we want to make sure that you're not socially distancing. So obviously within that, we've made sure that we give really good advice to leaders, to employees. We've got guides, and to some extent we will learn as we go. We might make mistakes, but actually we've given the advice so that people shouldn't step outside the bounds of what's acceptable. And if we have to learn things, we'll learn them as absolutely as we go. And certainly as part of learn how we go, we have definitely focused on those guidelines, but we have trusted people as well. And in terms of mental health, massively important at the minute, as well as things like ergonomics, as we put office workers into home workers. We have people that are trained in mental health first aid, and we've spent time, certainly I've spent time training, informing them how to have conversations in different ways, because let's be honest, 70% of communication is non-verbal. So we now need to make sure that they can have those conversations. We've given them the information that they need, as I've said and shown you before on a previous slide on the intranet. We're leveraging everything that we've got. We're empowering that social, because people need to be human. Leaders need to be able to lead. So we're trying to empower them to do that with advice, and also encouraging them to lead when they need to and also let go when they need to. We've also, and back to kind of the slogan that very much I'm kind of pushing within my own organisation, we're not socially distancing, we're physically distancing. We are social animals. We want to be social, but unfortunately at the minute we can't be there together in the same room. So we need to make sure that whilst we're not together, and we need to follow that to help the entire community, we can still be social through using effectively digital media or social media. And in terms of finding the space, some people, it's great if you've got a spare room, find it, use it. The picture there, I'm a bit geeky when it comes to ergonomics. I tried to find the smallest ergonomic space I could find, which was a pull-out tray that you can use to eat your dinner off, with my laptop on a stand, my son's gaming mouse, which is why it's glowing, and the keyboard I actually use on my iPad, and the teddy bear was one of the girls. So how can we, how can we work in different ways? So yes, we've done masses on ergonomics, as you would expect for home workers, and we today, in fact, I did a webinar with our guys, and I will continue to do those on how to kind of step outside the regulations but stay within them as well, so that we are keeping to the spirit of them. And I will very much say you can't do it once, because we've had home workers in phases where people have become home workers and then a week later some others have. But equally, even if everybody suddenly became a home worker, you need to keep sending the message out to reinforce it. I call it product diversification. It's the same message in a different shiny wrapper, to keep people interested, because you will engage some that you didn't actually engage before. Very much as well, we've been talking to people about maybe not working in the same room with your partner. Sometimes one of you has to look after the kids and take a hit, or one of you has to, as I'm doing at the minute, work in the bedroom while everybody else is downstairs. Do that. But actually as well, if you're doing that, actually maybe have lunch together and actually be more social, whilst also effectively not being social because you're not in the same room. Equally, use apps, use virtual media to be social with your team and with your friends. And in terms of relationships, all of a sudden, some of us are kind of looking at a family. I have my wife, my 3 children, and my dog, who I think my dog likes me the best, if I'm honest. But, we need family time. We need alone time. Actually, as well, what's really important, especially as we're those of us that have children, we need partner time as well. So actually, we need to take the effort and the time to make that time more so than ever. Excuse me. And let's look at this as an opportunity. We can learn. I've taught my older 2 children, and my oldest 14 and my middle one is 10, how to play poker, just because they kind of think it's funny that it's an adult game, but it kind of isn't. And we're just doing different things. We're playing board games. We're spending time together. We're finding new ways to spend time together and enjoy each other's company. And at work as well, it's a different team dynamic. We've got to accept that social media is different. We're going to learn. A lot of the teams I'm working with, they like talking on the phone, but they don't like video calls. Some of the ladies are saying, I have to get dressed and put my makeup on. Some of the guys, and literally, I only have this shirt on because I'm on this call. We're saying, actually, we have to get dressed up to do video calls. Why should we do that? Actually, 70% of communication is non-verbal. So maybe let's take the time to do that, and at times use video calls to do it. What kind of questions am I getting? Yes, I'm getting loads of questions on ergonomics, as you would expect. I've got loads of answers. We've got an intranet full of answers, and we're trying to answer them as much as possible. Yes, we're getting loads of isolated kind of mental health questions, and we've got loads and loads of stuff socially in-house that we're doing, and equally we're pushing within our teams to say, just share and talk, because that's important. And once again, it is a different team dynamic. So think about what tools you've got, lots of which are free online, and you can massively use them. And in terms of the return on investment, before all of this started, there was a massive return on investment in doing everything that I've kind of just said. And it will be more so now as we go through this and come out of this. It has been proven that you can get up to 20% more productivity if actually you go, let's look at social, let's look at our people, and everything else that we've got on this slide, from, you know, retention to, in general, reducing sickness absence and reducing, you know, the impact of things like mental health. And it's only, you can look on whatever country you are in the world, you can look at on the media and go, what employer brand got this wrong? You won't see the ones that got it right, but you will see the ones that got it wrong. You will have a strong employer brand if you get this right, even if it doesn't hit the press. So in terms of key takeaways, I would say, think about social media, or virtual media. Think about ergonomics, because if people aren't comfortable at home, if you've got a load of home workers, they're not going to be happy. Also, obviously, there's all the legal requirements, etc. I don't really want to get into the law, because as health and safety professionals, we know that. Team working will only benefit if we communicate. Work-life balance will only benefit if we encourage people to take it. And actually, at the end of all this, what we need to do is make sure that we get that chance to breathe, that we take in that breath, and really, you know, spend time with the families and take time to work with our colleagues. So with that in mind, I'm going to finish with a quote, which is that leadership, it's not about being in charge, it's about taking care of those people that are in your care. And I thank you before I pass over.
Okay, I don't know if you can hear me. I am somehow muted to start my video. But on the other hand, let me first of all say thank you very much to Tony for your very thought-provoking, there we go, I'm back. Your very thought-provoking presentation, Tony, really appreciate it. At this point, waiting very patiently in the background is Ruth Wilkinson. Ruth is the head of health and safety at IOSH itself, as an organization, as an institution. We have our own IOSH professional, and we're very proud and pleased to have that. IOSH is not only the leading professional body for safety and health, advising organizations and the profession on COVID-19, it's also an employer of approximately 200 people, and IOSH has its own duty of care. Ruth, could you please share your screen and provide us with your presentation?
I will. Thank you very much, Dr. David Gold, and thank you to Tony as well. Let's share my screen with you. Right, I hope you're all enjoying the webinar so far. I know I certainly am. And thanks for that introduction, Dr. Gold. You're quite right. IOSH is no different to any other organisation, because we're also an employer, and we have got colleagues who are remote working. So just like Tony shared with you his case study, I'm also going to share with you the case study of the approach we've taken at IOSH as well as the employer. So starting us off with them, just from a risk profile perspective and considering the context of the organisation, I just wanted to set the scene a little bit with you first about IOSH and who we are and what we do. So as you know, we are a professional body and we represent the occupational safety and health profession globally. So our not-for-profit and Royal Charter means we have specific governance requirements aligned to that. We are also provide thought leadership that's underpinned by research and evidence. We are the chartered body and membership organisation for OSH professionals. We have over 47,000 members in 130 countries. So by that token, we're global. We have employees who travel globally, and we liaise with volunteers who are also global. We are also an enabler of organisational success through the products and the services and the support that we deliver to enable organisations to meet their strategic goals. But coming in with that key point that we've just mentioned, we are also an employer. We're an SME. We have around 180 employees at the moment. We're based primarily at one headquarter. We have a handful of employees who are contracted home workers, Others might work ad hoc home working, but some just don't homework due to the nature of their role. To support our delivery model, we engage with approximately 1,000 volunteers, and they're also based within the UK and also internationally. And not all of our employees are health and safety professionals. They are professionals and experts within their own disciplines, such as IT, communications, and so on. So, although we are talking about the remote working, I just wanted to give you a bit of background as to what led IOSH to this point of sending people to work remotely. So when our initial response to the COVID-19 outbreak, we obviously initiated our business continuity arrangements. They were mobilised, and we followed any emerging guidance that we had from credible sources, so our government advice. And as part of our response to that, we tested different scenarios, we risk assessed those scenarios. So obviously I was part of that process along with senior leadership team and other colleagues within the business. We communicated position statements and any decisions that we'd made to relevant parties, so to our employees. What does that mean? Are we travelling? When is travelling stopped? Informing through our networks as well and volunteers. Obviously at this time with people becoming unwell, we monitored, responded to presenting symptoms, we advised accordingly, and obviously we took action as directed through those relevant sources, through the NHS, the government, World Health Organisation. And then we moved naturally to that predominantly home working model, which we're all a little bit more familiar with at the moment, and as we're discussing. But I just wanted to say for us at IOSH, we definitely, our response had people at the heart of that response. And I want to talk through this a little bit more in our case study example now. So that brings me to the challenges of working from home from the OSH, being occupational safety and health perspective. So starting off then, the home working, remote working, this isn't everybody's norm. So this in itself is a challenge for some individuals. They're used to a way of work, used to sitting at a set desk, doing a certain routine. So just that change will initiate different personal responses. So if you're familiar with that change curve, people will be at varying stages through this change. Not everybody has the same home situation as well. Some people might live in places that are actually just not suitable or might not be equipped to do that task from home. Some people's jobs might not be able to be physically done at home as well, and what does that mean to them? And with regards to the response plan, certainly for some of us in those countries where we've got this social distancing, we're also required not just to work at home, but for me, and also and Tony's mentioned it, I'm also required to have my children at home, which means I'm working from home and I'm also doing that educational piece for them while they're not at school. Or you might be looking after relatives, people might become poorly. So we've all got a mixture of things going on in our home lives. Also from an OSH perspective, those multiple or moving work locations can make it challenging to predict and control risks faced by your workers. There could also be reduced access to organisational information. So this means it's difficult for workers to stay familiar with the OSH practices and procedures. So this is something you need to think about. At IOSH, we've made sure we've got functionality like Zoom. So we're holding the same meetings with managers that we would otherwise. People can access the intranet through VPN. So people have got access to the same sources of information as they would have for us back at our headquarters or otherwise. So it's just something for you to think about how you do that. Limited face-to-face contact. Tony's just spoken to us about how he's changed that tone from social distancing to physical distancing. And obviously, as we said, it's important to have that social aspect. So with the lack of face-to-face contact, it can make it difficult to assess how well OSH practices are being carried out, and also in identifying how someone actually is. So how do you recognise those signs and symptoms of mental ill health? And we've stressed the importance of manager training in order to do this. So with that physical barrier, how can you overcome that? And obviously you can touch base with individuals. Things like Zoom and virtual discussions help put that face-to-face element back in the mix. And then lastly, this workers facing uncertainty. In the case of COVID-19, Many workers and organisations are facing uncertainty, and this can have a negative effect on workers' health, safety and well-being. There will be differing stresses, differing physical, behavioural and emotional responses to those stresses. And that uncertainty can come from a multitude of factors. It could be the fear of the illness itself, the fear of catching it, the fear of the consequences of it as well to themselves, their loved ones, family, colleagues. Also that fear of losing livelihood. You know, we've got the economic aspect as well as the health aspect, being socially excluded, feeling helpless, and so on. And I've got some sources of information at the end which lists these factors that I can guide you to. So therefore, managing workforces remotely requires strong communication, effective use of technology, and the requirement for flexible working, as we are in this unprecedented time. So just as Tony has mentioned, there are many risk factors that we need to be mindful of when adapting to this new work environment. And just to cover it off, I mean, Tony's covered a little bit on the DSE and the work equipment and ergonomics. And for our advice, and it says that organisations can train or inform their workers on the principles of workstation ergonomics, how to undertake their own workstation assessment. So doing that dynamic assessment, getting it set up, following a checklist or some advice and guidance that's being provided to them. And it's important to let workers know how to raise any concerns. So how do they do that? Who do they get in touch with? The health and safety teams, through line managers. And also make sure that your workers have the necessary technology in order to do the task you're going to be asking them to do. And they've got the training, the information and instruction to do that as well. Because I say this will be new to some individuals. They may never have homeworked before or only homeworked very infrequently. And sort of overriding, it's important to remember that some workers may find it difficult to adapt to working in an environment with that limited social contact. Others might thrive in it, some might struggle, and some might find it harder to manage their time or separate that home from work life. So when you are working and living in the same environment with others, it's important if you come up with that routine. How do you do that? How can we support individuals to do that? And with all the elements on the screen here, those risk factors, IOSH has produced a working checklist which can support you in your organisations to do this and disseminate some information. So considering everything that we've discussed so far and all of these challenges, within IOSH ourselves, we obviously actioned risks and opportunities from those. And the first big thing that we did was prioritisation. So when you're working remotely, it can be difficult to keep track of what is expected of you as individuals. So by prioritising different work streams, you can make it clear and communicate effectively what those priorities are. You can also deprioritise some of those work activities temporarily. This will help workers focus on the tasks that matter most to the organisation, and fundamentally it will help them from feeling overwhelmed. It will help prevent feeling overwhelmed from just the volume of the work. So if you can prioritise and give that clear direction, that's really useful. Also, when you're thinking about the work, if you can provide some variety of work to allow dynamic thinking and working, this will help to provide fresh cognitive challenges that allows workers to feel stimulated, motivated and productive. So where you can and the work enables you to, if you can give that bit of variety, it will have those benefits. And a big one, as we've just mentioned, is we're all in these situations of managing different work patterns and childcare and family support, and just trying to get out to the shops to grab the basics and the necessities. It's allowing flexibility. So allow workers to take extra rest breaks if they're required to do so, and if they need to address any concerns, such as childcare commitments, and ensure that work deadlines and timescales are reasonable, as this can help reduce stress as well. So I think it's just that acceptance of the time we're in, having that little bit of compassion as well. And communication is a big one for me, and it's important to establish those strong lines of communications with workers during the extended periods of remote working. So within IOSH we have regular communications from the chief executive through managers, the enabling services, and this covers a multitude of advice, guidance, information on what it means for their employment, their pay during these times, the finances. So if we can be as transparent, it will help people realise and I suppose understand how their job is being looked after at the moment, how they're being protected. And it'll all help keep workers feeling motivated and supported during these times. Of course, you don't want to overwhelm them with the amount of information, but what I'm trying to do is plan the release of some of this information so it doesn't become overwhelming all at once. And for me, I always think of communication as the push of information. So you're pushing information out to inform people, but we also need to think of employee engagement. How do we keep them engaged during this time? And I'll talk about some of the examples we've been doing now. So within IOSH, the health and safety teams, that's myself, my colleague, the health and safety business partner, we've been working closely with the head of people, the people team and other colleagues across the business to collectively support our workers. So whether those workers are working remotely or how they're working at the moment, and considering their mental health and well-being is the top of that priority. So some of the strategies that we've utilised internally, we started with the principles of prevention. So, you know, the things like the hand hygiene, respiratory hygiene, before we moved to that working from home strategy, which we're still promoting and pushing that because it's important we all do these things. Online on our intranet, we've set up a primary source of information. So again, people have got one version of the truth. They haven't got to keep going looking for it or getting information coming to them from different means. This is the source of information that they can go to. We've also updated our desktop to reflect the 5 ways to well-being. So this just shows employees that you care, and it's a very quick, simple, easy method to remind people of those 5 steps. So things like connecting, being mindful. So it's just a little reminder that's there in conjunction with the other streams of communication and engagement that's happening. When this all started, we initiated a series of frequently asked questions for employees and managers, and this has been regularly updated as the guidance from the government and World Health Organization was changing as well. So this was pertinent to our employees and what was happening, and we continue to keep those available and update them. We've also produced a series of top tips, so top tips being advising managers on how they manage remote workers, advising employees on how to look after their health and well-being while working from home, the ergonomic setup that we've mentioned. We've also looked at peer-to-peer support as well. So not everything's getting directed from the management team, senior leadership teams, but actually there's a peer-on-peer level of support there, which is also needed to keep those social contacts. And all of these together just helps sustain that resilience, support, motivation, and efficiency and productivity for individuals, because there will be peaks and troughs. So that's why the timing of some of these reminders and tips would be useful to map out as part of your engagement strategy. And some of the tips I haven't done yet, we're going to be focusing on the resilience side, so that psychological resilience and the motivation. And we're timing that to come in the next week or two. As I say, we can see this is going on for a duration, so we're going to time that information just to support colleagues through this journey. I keep mentioning engagement, and to help us do that, we've got an engagement strategy, which our comms team has been leading on, which has been fantastic in pulling all this together. The peer-on-peer support, in order to do that, we've pulled in the employee forum, and they've been great at leading on this. So it's things like virtual coffee mornings. So as well as having all these Zoom meetings for the work type of chatter and discussions, the virtual coffee mornings actually gives you that social break that you'd get if you were just making that cup of tea in the office or going to the printers, and you can see people's faces that you probably won't see in your meetings like you do when you're walking around your work environment. So that's been great. We're also looking at some virtual quizzes and clubs as well. Some might be inside work. We're also pondering doing some bits outside of work for those individuals who might be living alone and got those different situations at home. Just another one as well, in recognition of the here and now, we've also adapted some of our delivery models. An example being an onboarding model. So this will support the organisation, but it also supports new starters who are starting in these unusual times to make sure they get the information they need, and we can still continue to operate virtually in this manner. Right, so it's kind of coming to a few sort of summary slides about our findings then. So these are our lessons learned, but it's also coupled with the research that our advice and practice team pulled together for IOSH, and also all the information is available on the IOSH internet page. So this is pitched at for senior leadership teams, and in normal times, the senior leadership team will have a focus on issues such as work culture, employee engagement and delivery of the corporate strategy. But the COVID-19 outbreak has presented new challenges to executives in all areas of strategic leadership. Workplaces need to ensure they are engaging with employees in a positive, transparent way and are providing regular updates on organisational objectives and key priorities. So thinking about the work culture then, how is your workplace embedding a strong safety and health culture within its workforce? Employee engagement, how are you ensuring to engage and communicate with employees while they are working away from the office? And on the managing health and wellbeing, as we're discussing, how can you take measures to protect the mental health and wellbeing of workers while they are working remotely? And thinking of our IOSH practices, which existing IOSH practices in your business can be modified, and what bespoke practices can be embedded for those distributed workers. So some of these are examples what we've done internally at IOSH that we've just mentioned, that we've modified some of our top tips on working remotely to satisfy the here and now, because you wouldn't normally be working with your childcare at home per se. Some of that advice for line managers then, it's important for line managers to realise that workers will be looking to them for clarity, support and guidance. So line managers need to make themselves available for colleagues to contact them. And so part of this is providing competent and motivational leadership, and this reassures those distributed workers during this unpredictable period of their working lives. It's important to provide regular and clear communication, and this needs to be from both the line managers and IOSH professionals to workers and vice versa, to help maintain that company culture and those practices remotely. Straightforward and adaptable procedures, this provides workers with structure in an unprecedented working environment. Make sure resources are kept up to date and they're easily accessible and available, and this equips the workers with the information that is required. And make sure you've established some monitoring and reporting systems. So this helps to both protect and empower those workers. So sort of the top tips for managers then is sort of keeping that regular contact. This will help those feelings of isolation and loneliness. Communicate the organisational plan. So be open and honest with workers to ensure that clarity. Use varying methods of communication. Tony mentioned a whole raft of communication methods they're using in his organisation, but things like teleconferences can introduce that visual human interface, also going on the phone, the emails and other applications like WhatsApps, whichever benefits. With regards to social distancing, obviously in the here and now, where we don't need to, we can conduct virtual meetings, but in those rare circumstances where face-to-face meetings need to occur, it's important to follow the government's advice on social distancing at that time. And obviously that's relevant for those key workers. Point 5, we've got provide support. So particularly where there are reasonable adjustments that are required. So if people need reasonable adjustments in the workplace, what do we need to support them at home? It's important you set those boundaries between work and non-work. So how can that be done, and how can we allow and support individuals to do this? And we need to encourage employees to talk about their well-being and mental health. We want to prevent things from worsening at this stage, so anything we can do to prevent that stigma, having those open conversations, will support.
Ruth, can we start to wrap up there a little bit, because we need to be able to, if you could just very quickly go through this slide, because we need to have a little bit of time for questions and answers, please.
Yes, of course. Thank you, David. This is my last main slide, I've got another one after this, but I just wanted to remind colleagues who were on the webinar last week of Dr. Ivanov's slide about the role of the IOSH practitioner. And I just wanted to say that in my reality, that my role as an IOSH practitioner is reflective of that slide. So just to say that I have been involved with assessing risks, identifying vulnerable groups, providing advice, looking at preventative protective measures, participating in the business continuity plan, the communication and engagement, collaboration, and at the moment I'm already thinking about those recovery plans when we return post-pandemic. So hopefully this reflects what you're also doing in those roles. And the last key point is to make sure that you don't follow those fake news. There's a lot of fake news out there at the moment. So please do use information from factual, clear and reputable sources. And I just want to end there, David, on a few sources of information that colleagues can go to. So obviously we've got the IOSH website on there, different bits of guidance from the World Health Organization, and all of this will be useful to have a look at with regards to mental health in this current time. So thank you.
Thank you very much, Ruth. This was an excellent presentation. In fact, I was so pleased when you put up Ivan's slide, because I was going to bring the 5 or 6 points up, or the 8 points that Ivan raised earlier after the presentation. So you actually saved me time for that. We'll now have an opportunity to discuss some questions in a few moments. And while we go through these questions and while we go through a number of different issues, I'd like you to keep an eye on the poll we're launching through chat, as your feedback is really important. And as was just pointed out, IOSH has its own COVID-19 resource page with advice and guidance. So this will be included in the post-webinar webpage. We are very fortunate to have Ivan Ivanov back. Ivan is a friend and former colleague that I've known for well over 30 years. Ivan was just a kid when we started with this thing. But he's playing a very, very key role in this pandemic as a safety and health person. Ivan in WHO has a responsibility as being the team leader of occupational and workplace health. Ivan, could I turn this over to you? I think you want to talk to us about a questionnaire. And Ivan, at the same time, I would really appreciate it if you could stay on through our question and answer period. It'll probably only be about 20 minutes considering the time, but if you have the time, we'd appreciate it if you'd stay.
Thank you, David, and thank you very much for IOSH to follow up on our request at the last webinar last week to collect some information regarding the occupational safety and health of workers in essential public services. And I'm really moved that by a message from the last webinar about the role of occupational safety and health professionals to move into the front line of COVID response is actually has been taken serious. We also see ministerial orders and regulations from France and Spain. I have the examples of the government actually reorienting occupational health services toward providing first response for protecting the workforce in the enterprises, in the public essential public services, and in the hospitals. So this is extremely important. WHO has now been asked, the department and our team has been asked to prepare specific guidance on how to protect the health and safety of workers in those essential public services that still have to operate in order to maintain the business continuity of the society. And this includes anything from security, emergencies, energy supply, food retail, deliveries, water, sanitation, garbage collection, banking system, all these that keeps the society alive. And together with IOSH, actually, we have put together a questionnaire for an online survey for collection of data from IOSH professionals, both the opinions of IOSH professionals about the risks for the workers in the essential public services, non-healthcare public services, the risk of workers for contracting infection of COVID-19, and the adequacy of the protective measures that are taken. But also we're looking into the other non-COVID occupational risks that may have increased, decreased, or some of them may have eliminated during the COVID crisis, particularly for these essential services. So I really appreciate the support, and we really rely on the wisdom and the experience of this global IOSH professionals community to actually feed and provide information so that we can make the right recommendations. Thank you very much.
Thank you very much, Ivan. It's always good to hear from you, and we very much in the profession appreciate the collaboration with WHO as well as ILO, and the excellent work that the WHO is doing to try to support everyone during this health crisis, during the pandemic of COVID-19. So, ladies and gentlemen, it's over to you. A number of you have asked questions. This continues to be your opportunity to ask questions. We only have maybe 10 or 15 minutes to try to respond to some of these. As you know, I've asked Ivan if he would stay on with us because there are some questions that might be relevant to them. I notice in the question panel that the speakers, Ruth and Tony, have already answered a number of your questions. For example, the first question that popped up was, how can I help my organization's safety and health officer? And I think the last slide, or the penultimate slide that Ruth used, starts to address that question. The question about masks continues to come up, whether masks should be used or shouldn't be used. Some countries say yes, some countries say no. Ivan, could you just very, very briefly give us an update on where we are? It's kind of out of the scope of this, but I think it's on a lot of people's minds.
Yes, it's in a lot of people's mind. It was just released a new guidance about the use of masks that I replied to one of the questions with the link to this guidance. It is not very simple to recommend to the whole society to wear masks, because also wearing masks has risks of infection. These masks, they need to be changed, they need to be cleaned, they need to be disinfected, they need to be maintained so they don't become actually sources of infection. So that's why there is no yes or no answer to the masks. Masks are possible where it is necessary. It requires some form of a risk assessment. But in general, WHO does not recommend everybody at the workplace, at on the streets to be with masks. There are risks also of relying too much on masks and neglecting the other more important actually measure for prevention, which is hand hygiene and social distancing.
Thank you very much.
Physical distancing.
Thank you, Ivan. There has been some questions, several questions that were relating to psychosocial issues. I'm going to be very, very broad when I talk about psychosocial issues. There's been some questions relating to an increase in domestic family violence. There's an increase in, there's some questions that even relate to you're working at home, there's a lost family member, there's the whole process of grieving. This is a difficult sort of thing. Tony, from the psychosocial perspective and leading a safety and health effort from a fairly large multinational company, this issue of domestic violence, this issue perhaps of a lack of communication, also there's an issue of stigma that seems to be surfacing. Could you very briefly give us a response to that issue?
Yeah, and that's quite a difficult question, and certainly at times we have employees that are coming into the office when perhaps they wouldn't need to, because we could provide them with laptops to work from home. The issue of kind of domestic violence is one that it isn't easy to overcome. Obviously, there are plenty of charities out there that are trying to help with that. It's kind of I suppose what I'm trying to say is that there is no one answer for that, because the reasons for it are multiple, both with male and female, obviously, and there is genuinely no easy answer. There are certainly in terms of the charities, they're suggesting you can go to other places in which you could reside. But we are seeing, as not only our society, but in lots of societies, we're seeing massive challenges in terms of relationships, and relationships are, they're difficult, they're emotional, they're not logical, and there is genuinely no one answer in terms of what we could do, certainly as employers, in terms of helping with that. At times it's giving support and giving advice, because people sometimes are so kind of involved in their own heads that they can't see solutions. I'm going to shut up now, because there is no easy answer to that question.
Thank you, Tony. It wasn't an easy question, but I'm going to now slightly modify this question and ask Ruth if she would be willing to comment on it, because one of the important points, the points that you've shared with the employees, the colleagues in IOSH that work together, is the issue of communication. And when we talk about stigma, when we talk about issues of a lost family, when we talk about issues of domestic problems, it seems that within the scope of IOSH, within the safety and health profession, within IOSH, you're focusing on communication as a major means of trying to tackle some of these issues. Could you comment on that, please?
Yeah, thank you, David. And you're right, communication is key, and it's knowing the risk profile of your organisation. And obviously, with the point we've just mentioned, we don't always know what's going on, but it's important that you have information and support avenues that are there available for staff, and they're aware of them. And that's part of why we need to touch in. And it's important line managers have those regular conversations with their staff. They know about what's going on and can support and advise accordingly. And that's so for me, I've got those 2 kids at home, and my line manager's very aware of how to support and give that bit of flexibility. And that's why we said, from the mental health perspective as well, it's important to encourage that communication, and everything you can do as an organisation to help show and promote and support individuals' health and well-being. You can break down those stigmas and enable the conversations. We also have sort of third-party options through EAP. Colleagues can go to different avenues for support. So just making sure individuals in your workforce are familiar with and know how to access those support services. And it is a tricky one to answer. So I suppose it's the more you can do, but it is looking at the individuals and that sort of risk profile, and it is supporting in the home side as well as the work side.
So if there are 2 points that perhaps come from both Ruth and Tony. One is the importance of ongoing dialogue, ongoing communication amongst everybody concerned. And what I heard from Tony, to add to that, is it's important to be able to reach out, to find some sort of mechanism, some sort of counseling, if things are getting to a point where they are becoming difficult. Ivan, I have perhaps one last question from you that came from one of our people that are attending the seminar. We have 1,065 people, the last count I heard, as far as the seminar is concerned. There is a certain amount of fear amongst people still today that they are going to contract the virus, that the virus is going to be part of them. And we know some of the outcomes are not the nicest outcomes. What can we do? What can we say to perhaps assuage, to alleviate the fears on contracting the virus today? Still with us, Ivan? Maybe we've lost Ivan. No, he's still there. Ivan, are you, there he is, okay.
Yes, I'm here. I was multitasking.
Okay.
Tell me what was the question.
Okay, Ivan, a question came up that some people are very, very fearful about contracting the virus, the coronavirus, COVID-19. And what can we do to maybe not completely alleviate the fears, but what can we do? What messages can we give as safety and health practitioners, as safety and health professionals, to the workers, to the people we work with, to the people we're responsible for, to try to deal with some of these fears that people are facing?
Well, in addition to the general occupational health and safety, we also recommend providing psychosocial support. And this is quite a specialized area, psychology, where our people can discuss their fears and can discuss their worries with the psychology, and then they can get an advice which is dependent on the situation of the fears. But in general, it is important to follow the official information and not to focus too much on the news, because the news only increase the fears, and to focus on activities that are pleasurable, that give you pleasure, hobbies, to watch movies that do not have viruses, and to just relax and take the time.
Okay, thank you, Ivan. I'm afraid we've run out of time. We've had 2 excellent presentations. We've had 3 panelists that have responded to your questions. So many thanks to all of the people, over 1,000 people that are listening today. I would like to again extend my thanks and my apology for cutting you off perhaps, to Tony and Ruth, and also to Ivan for joining us today with this webinar. We will be sending you the link to the recording via email, so please look for it in your inbox. Now, there are many questions that we've had. We've not been able to answer all of them. I understand that these questions will be answered, that we will attempt to answer all of them and get back to you. In the meantime, I'd like to mention to you, remember this is the 2nd of a series of webinars which will take place over the coming weeks. So keep an eye on the IOSH channel for details on the next webinar. In our next webinar on Thursday, 16 April, the World Health Organization and our IOSH Health and Social Care Group will focus on a discussion on the current challenges and occupational health protection measures in the healthcare sector. With more details on this, you can go to the IOSH hashtag COVID-19 webinar page. So you can, you'll be able to find that information there. But for now, I would like to express my appreciation to all of you for joining us. One person did ask about a certificate for these webinars. I think it's important to remember that we can capture all of these as part of our continuing professional education. But more important than that, we are educating ourselves so that we can educate our coworkers how to be healthy, how to be safe, how to protect themselves in some very, very difficult times. So from my part, as a member of the IOSH presidential team, again, thank you all for joining us. I'd like to thank the professionals at IOSH also who helped put this whole package together. And last thought, be safe, be healthy, take care of yourselves, take care of your family, and look forward to seeing you sometime in the future. Thank you very much.